joint pains, hypertension, ischemic disorders, blood disorders, immunodeficiency, or tuberculosis. Similarly, the past surgical history was insignificant as well. There was no history of any dental procedures done. The past ocular surgery of patient similarly was insignificant as well. There was no prior history of any ocular infections, no use of glasses, no ocular surgery, no laser, no trauma, and there was no history of any topical medication for any eye-related issues. Similarly, the family history and the socio-economic history of the patient was insignificant as well. Coming on to the examination, first of all, we did the general physical examination. The patient was well oriented in time, space, and person, and as you can see on your screen that the vitals were stable except for the temperature that was 100 Fahrenheit. There was no pallor or cyanosis, and the lymph nodes were not palpable as well. This was the presentation of the patient on the first day when she came to us. As you can see that both her eyes were swollen, with the left eye more swollen as compared to the right eye, and she could only open her right eye, and the left eye could only be opened with the help of a doctor. The skin of the both eyes of the patient was erythematous, hot and tender. The eyelids were swollen bilaterally, the eyelashes were mated, and the patient had ecchymosis in her left conjunctiva, but the right was normal. The vision of the patient bilaterally was 6 by 6, and the rear vision was 10 by 6, that is normal. And the color vision and the visual field were normal as well. These were the findings of the slit lamp examination of the patient. As you can see that these were all normal. The cornea were clear bilaterally. The AC was quite and normal. The iris were normal as well. The pupils were round, regular and active to light. There was no relative apparent pupillary defect found. And the lens of the both eye were clear as well. Coming on to the extraocular movements of the patient. As you can see here, these are the extraocular movements of the right eye. The extraocular movements of the right eye were normal in all four quadrants, and they were not painful, while they were restricted and painful in the left eye. As you can see here that she is able to do her left extraocular movements. So these were the three differential diagnoses that we came to after going through the history and clinical examination. These included orbital cellulitis, idiopathic orbital inflammatory disease, and orbital tumors. So as we knew that the patient had a history of chronic sinusitis, so we had a suspicion that her parietal sinuses could be involved. So we decided to take the consultation from the ENT department, and they did an endonasal examination of the patient and confirmed a suspicion that her paranasal sinuses were indeed involved.